So is this something that you find that patients often resort to? Is this usually a first line of kind of treatment or something along those lines? Where does the laser hair removal conversation typically come in?
So for patients who have mild to moderate disease, that's something that I usually recommend, and it's also recommended in the treatment guidelines for HS. And we're having a hard time getting insurance coverage for these. So a lot of times, we're sending patients to medical spas that have these lasers and for the treatment. Yeah.
And I just want to just step to the wound care and the kind of post surgery recovery because you mentioned not necessarily being able to suture things the way that you normally would. So, what does recovery look like with that type of surgery, typically for the
Yeah.
patient?
Well, it depends on the surgery, the type of surgery that's being done. Is it deroofing or wide local excision? Wide local excision treats a larger area, so obviously that's going to take much longer to heal. But with the deroofing surgeries, we're looking at 2 to 3 months, where it completely heals on its own, and it's remarkable how quickly the skin, the body heals once you remove that inflammatory tissue. Yeah.
And then with the more intense surgeries, about what's the recovery time or process for patients?
Well, usually 3 months at least, or even more, given the extent of area that's treated. But patients are able to actually tolerate this because it remarkably, the post-op pain only lasts for the first couple of days or weeks after the procedure. So even though they have this open wound, the pain is actually minimal. I have a lot of patients who would tell me after they do the surgery that, wow, the pain from the surgery was not even as severe from the pain they get with their HS flares.
Wow. So, how do you manage recurrence after surgical intervention?
Yeah, that's a great question. So, you know, that tells us that there's still inflammation in the body, and we need to focus more on medical treatment before we look further into surgical treatment. So, for those patients, if they are on a biologic medication and they're still getting recurrences, then we look at switching to other biologic treatments. Thankfully, now we have 3 biologic agents that are FDA approved. So it's a bit easier to get these treatments for these patients.
I just thought of this, thinking back to what you mentioned about laser hair removal. There are also topical creams that remove hair as well. Is this something that patients utilize at all, or is it what are the pros and cons of that?
Yeah, so we don't recommend those creams because they do have the potential to cause inflammation, so local irritation, but also these creams, that's temporary removal. So these hair follicles will grow back eventually, and when they grow back, then that's when you start to get issues. Sometimes, especially in darker skinned patients, because our hair follicles are more curly and coarse, so we are more likely to have ingrown hairs, and that can also cause HS to flare.